The well-being of your workforce is not a nice to have. It's a strategic imperative. You cannot achieve excellence in quality, safety, patient experience, or financial sustainability without a healthy, supported workforce. And I would also challenge us to aim higher than simply reducing burnout or decreasing workplace violence or moral injury. All of those are important, but just like health is not merely the absence of disease, we shouldn't just be trying to get rid of burnout and moral injury and workplace violence. True workplace well being is not just the absence of distress. So imagine a future where workplace violence, burnout, or moral injury trigger a formal review process and meaningful organizational reflection, where frontline workforce are protected not just physically, but also emotionally, ethically, and psychologically. And I want to emphasize that this work and these concepts are not about making people tougher. Just like we wouldn't ask a nurse to lift a heavy patient without a lift device, we shouldn't ask them to carry moral burden, burnout, or physical risk without support. So it's time to bring that zero harm movement to the people who make healthcare possible.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where world-class healthcare leaders seek to solve big problems. Listen as we talk to today's health system CEOs about the journey to achieve their moonshots.
Welcome to A&M's What's Your Moonshot podcast series. I'm Bionca Jones, a senior director in Alvarez and Marsal's Healthcare Industry Group, focusing on health plans and managed care organizations. I'm joined by my co-host, Dr. David Shulkin, an A&M senior advisor and 9th secretary of the U.S. Department of Veteran Affairs. We are excited to welcome to the podcast today Dr. Heather Farley, the Chief Wellbeing Officer for the Medical University of South Carolina. In her role, Dr. Farley is focused on advancing the professional fulfillment and well-being of healthcare team members, faculty, staff, and students. She is a professor of emergency medicine at MUSC, has held several leadership positions within the American College of Emergency Physicians on the state and national level, and has co-authored multiple peer-reviewed journal articles. Welcome, and we're looking forward to a great discussion.
Thanks for having me.
In your current role as Inaugural Chief Wellbeing Officer at MUSC, you've proposed a bold moonshot to treat workplace violence, burnout, and moral injury as preventable harms, just like infections or medication errors. Tell us more about your moonshot.
Well, in healthcare, as we know, we've made tremendous progress in reducing patient harm, things like infections, falls, errors, because we've declared those harms unacceptable. We track them, we learn from them, and we redesign our systems to prevent them. But what about the people who care for those patients? And so my moonshot is to apply that same level of urgency and accountability to workforce harm. That means recognizing burnout, moral injury, and workplace violence not as unfortunate byproducts of just working in healthcare, but as preventable, reportable system failures. So imagine a future where workplace violence, burnout, or moral injury trigger a formal review process and meaningful organizational reflection, where frontline workforce are protected not just physically, but also emotionally, ethically, and psychologically. And I want to emphasize that this work and these concepts are not about making people tougher. Just like we wouldn't ask a nurse to lift a heavy patient without a lift device, we shouldn't ask them to carry moral burden, burnout, or physical risk without support. So it's time to bring that zero harm movement to the people who make healthcare possible.
Dr. Farley, I think that's terrific. We've had a lot of moonshot episodes. I don't think we've ever had any leader talk about this issue. So we're really glad that you're bringing this to the table. Your title at the Medical University of South Carolina is the Chief Wellbeing Officer. I don't think I've ever met a Chief Wellbeing Officer. So tell us a little bit about that role. Maybe, do most institutions have a Chief Wellbeing Officer? Maybe I'm just out of touch. And is it unusual for a physician to be in that role rather than, normally a human resources person? So tell us about that and whether you see other institutions adopting this model.
Well, I'm glad you finally met a CWO. And the chief wellbeing officer role is definitely an emerging role. It hasn't always been there, but we are seeing more and more health systems hire CWOs. I think as an industry, we're finally acknowledging that we can't achieve excellence in healthcare without supporting the people who deliver it. And we've become more sophisticated in how we need to do that above and beyond what HR normally does. So at MUSC, I'm responsible for leading the well-being strategy and operations for our 34,000 individuals across our hospitals, clinics, and academic campuses. And at MUSC, we treat well-being not just as a program over here on the side, but as a core organizational priority, on par with our quality and safety, patient experience, and financial priorities and outcome measures. And I think there's growing recognition that the well-being of the healthcare workforce is deeply interdependent with the other aspects of the quadruple aim. So when we invest in workforce well-being, we see measurable value, not just in improved engagement and reduced turnover, but also in patient safety outcomes, patient experience outcomes, and even the bottom line. And so I know we'll get into metrics later, but it's important for us to measure and hold ourselves accountable for some of those lagging indicators, but also the leading indicators of a culture of well-being. But I think that value of the investment is becoming clearer to health systems and to executive leadership. And I think it's equally important that this role sends a message to our workforce that their well-being matters, that it's not an afterthought or something done on the side, and that we're committed to creating that environment where they can thrive.
To your point, in many organizations, well-being initiatives can feel like a nice to have rather than a critical safety issue. How are you working to shift that mindset within your health system?
You are so very right. That mindset of, oh, it's a nice to have, it's a perk. That has been one of the biggest barriers across the healthcare industry. And honestly, it's a mindset we have to unlearn. Well-being is a strategic and operational priority for health systems. It's not something we do on the side. And so at MUSC, we've embedded well-being in our enterprise-wide strategic plan, right alongside our access, quality, safety, and financial stewardship goals. We've also built alignment between our well-being efforts and outcomes that health systems also care deeply about, like reducing turnover, improving engagement, and enhancing patient experience. So in that way, we've helped people see, again, that interdependence between these aspects of the quadruple aim, and well-being work is not a separate lane, but foundational to everything else that we're trying to achieve as an organization. And again, we're grounding all of this in data, both qualitative and quantitative, so we can measure the impact and hold ourselves accountable just as we would with any other strategic priority.
It doesn't totally surprise me that you're an emergency medicine physician. I have embedded in my mind this one picture from a hospital that I was at where they just took a picture of all of the weapons and different types of sharp instruments that they collected from patients who have come into the emergency room, and they confiscated. Was there something in your personal story or something in your history that you said, you know what, I'm gonna focus on this part of my career and maybe less on your emergency medicine clinical part of your career? And as a second thing, maybe you could just tell us a little bit about an example of what you do during the day.
Yeah, so I will say, if you had asked me or told me that I was going to be a chief well-being officer 15 years ago, I would have laughed at you. So this was not in my plan, but
Right.
I did have a very personal experience that changed the trajectory of my career. So as an emergency physician, I was taking care of a patient who actually was one of our employees, and I
Mhm.
discharged her, and she died unexpectedly on the way home after I discharged her, and that threw me into
Yeah.
a personal and professional tailspin that
Yeah.
took a long time to recover from. And at that time, it was a time when you didn't talk about these things. And, you're just get back on the horse, suck it up, and, put your armor on. So after I recovered from that, I began to talk to my colleagues finally, and I understood that, oh my gosh, it wasn't just me. We all had these experiences because working in healthcare is not normal. We see and do things that other people couldn't imagine, in a normal office setting. And I thought, oh my gosh, we have to change the culture in healthcare, and we need to move away from this space of shame and blame and silence and move towards self-compassion, mutual support. And so that really was a pivotal moment for me, and the decision to now dedicate the rest of my career to this work. So one of the things that we're working on that relates to the story I just told you at MUSC now is a multi-pronged effort to create that or foster that culture of well-being. And a key part of that is creating an environment where it's okay to not be okay sometimes. And we recognize that psychological harm is real, and we ensure that people have support after distressing events, much like a debrief after a patient safety event. So a couple of really concrete efforts in that area that is helping us move that culture is stress first aid training. So this actually initially was created for the military, but it's been adapted to healthcare. And the idea behind psychological first aid is not that we're not expecting people to be counselors or therapists, but giving people the skills to recognize when someone around them is struggling, to respond effectively and get them connected to resources if that's what they need. And so we're training teams and leaders in stress first aid. And we have one of our people pillar goals is to train at least 30% of our leaders across the enterprise in stress first aid by the end of this fiscal year. And we're already close. Above and beyond stress first aid, a second example of a concrete initiative in this area is peer support. I think in the moment, what people really want is a peer who has been there and can serve as a friendly, confidential ear to help you process the difficult emotions after those events. So we're training peer supporters across the enterprise, and they are proactively activated, and it's not waiting for someone to raise their hand and say, I need help. Last example of a program to decrease barriers to help seeking is our partnership with the Dr. Lorna Breen Foundation. So that organization has been instrumental in tackling the stigma around mental health and healthcare, and they've helped shift policies across dozens of states so that seeking care for mental health concerns is no longer a threat to your medical license, and people can feel safe reaching out for help.
Thank you for sharing that. I love the concept of the first aid, and it's okay not to be okay. When talking about success, what role does data, metrics, and accountability play in achieving your moonshot? And are there specific measures you're focused on implementing?
So absolutely, data and accountability are essential. We can't improve what we're not measuring. So at MUSC, we've aligned our metrics with both human and operational outcomes. So we're measuring a host of well-being metrics, as including psychological safety, a sense of belonging and connection, trust in leadership, work-life harmony. So these are some of those leading indicators that I mentioned previously. But then we're connecting those measures to other important measures like patient experience, quality outcomes, and cost. And so again, we're not treating workforce well-being as a separate entity from the rest of our performance, and recognize that it's deeply integrated. And we've built structures of accountability to support that. So I mentioned that well-being is part of our enterprise strategic plan. It's also embedded in how we evaluate leaders. So we've rolled out well-being leader standard work. So here's, actionable strategies that we expect leaders to use. And it's, again, I don't want this to be something that we're piling on top of leaders who are already overburdened, but they're already dealing with teams that are experiencing burnout and mental health concerns. So we're giving them the tools so that they actually, to help them support their teams. So we've made a deliberate choice to track progress in how our leaders are supporting their teams, including report outs in all of our monthly executive leadership meetings. And ultimately, the goal isn't just to reduce harm, though, right? It's actually to design systems that allow our people to do their best work with clarity, connection, and purpose. So we've got to measure, track, and hold ourselves accountable, just like we do for other measures across the enterprise. And I think that's what real accountability looks like.
Dr. Farley, so much of what you're talking about is really, connecting with the humanness and the emotions of being in healthcare and dealing in tough situations. I wonder what your thoughts are about technology and whether the fast sort of moving pace of artificial intelligence in healthcare may add to the stress on people as their jobs potentially have to change or maybe are being threatened, or potentially could really help in terms of burnout, taking away a lot of the administrative tasks. And so how do you think about that in the work that you do?
Yeah, I think we're all really closely following what's happening with AI, right? And I think it has tremendous potential to decrease some of the friction that exists in the healthcare workforce just doing their daily jobs, right? And especially lots of energy and interest around ambient technologies. I would say from a physician perspective, I don't think that AI is going to replace physicians, but I think that it will be essential for our physicians to learn how to leverage AI, because it is possible for in the future that physicians who know how to leverage AI will replace physicians who don't. So I think there's an opportunity and a threat there. But I will also add to that and say that, we've talked a lot about culture of well-being, and there's another component that really significantly impacts people's experience and work, and that's really the efficiency of their workplace. And so that's one of the things that we're really focused on at MUSC as well. And one of my very favorite initiatives is called GROSS, and that stands for Getting Rid of Stupid Stuff. And so identifying and removing the administrative burdens, the red tape, the pebbles in our shoes that get in the way of us just doing our job, and enabling us to therefore focus on the more meaningful aspects of our job. So, I think the GROSS program, AI definitely is one of the tools and levers that we can use to help us remove some of that friction in care delivery, which causes a different kind of harm for our people, right? So we're working to remove those pebbles in our shoes, and AI is one of our tools.
Could you share maybe any lessons learned or ideas with your peers across the country in healthcare? And if so, what would that be?
First, I'd say the well-being of your workforce is not a nice to have. It's a strategic imperative. You cannot achieve excellence in quality, safety, patient experience, or financial sustainability without a healthy, supported workforce. And I would also challenge us to aim higher than simply reducing burnout or decreasing workplace violence or moral injury. All of those are important, but just like health is not merely the absence of disease, we shouldn't just be trying to get rid of burnout and moral injury and workplace violence. True workplace well-being is not just the absence of distress. So how can we design systems where our people can find meaning, connection, and joy in their work? And I would say our former Surgeon General, Vivek Murthy, has said that a healthy workforce is the foundation for thriving organizations and communities. And he challenges us to build workplaces that are engines of well-being, places where people know that their work matters and that they matter, and where they have the resources and support to flourish. So I'd highly encourage listeners to check out the Surgeon General's framework for workplace mental health and well-being. It's a goldmine. Healthcare is uniquely challenging, certainly, and especially right now, but it's also uniquely rewarding. So we have an obligation to design systems that minimize preventable harm for our workplace and for our workforce, and maximize opportunities for that meaning, connection, and joy in healthcare.
Dr. Farley, we just want to thank you so much for joining us on What's Your Moonshot. This is really such an important component that we haven't discussed before. And ultimately, that's what our industry is about. It's about people helping people. And so we're really glad that you're doing this work. And we know that others around the country are very interested in what you're doing and hopefully can emulate and learn from the lessons that you shared with us today. So thank you very much.
Thanks for having me today.
Alvarez and Marcel. Leadership, action, results.